So basically my problem is the recurrent attacks of head spinning, often with nausea and vomiting. And when I was sitting in the reception, I was supposed to tell you about the frequency of the attack, the duration of the attack, and the precipitating factors of the attack. So I just want to know that whether there is a instability or there is any sinking sensation or a spinning sensation. I have written down all those questions and answers, and I just let you know.
You may show me the answers that you have written, or if you feel comfortable, you may read them out also.
You will not be comfortable in deciphering my handwriting. Just let me say in my own way.
Okay, go ahead.
So in my case, the duration is highly variable. It varies from seconds to days. Today I got an attack which was 10 to 15 seconds, and in the coming 7 to 10 days there may be another attack. But in last 2.5 years, I got 2 severe unabated episode, and out of one which I had to admitted in hospital, and because of severe vomiting, and I was very sick at that time.
When you get these attacks of giddiness for a few seconds, do you think that they are precipitated by any change of head position?
Usually not so, but in some instances I got recurrent attack with head position alteration. So when I took from local doctor a Vertigo, then meticulously it stopped that episode for few instances. But this giddiness happens only once or twice, remaining other time it is totally unprovoked.
During the longer attacks, that means the ones that lasted for a few minutes or the ones that lasted for more than a day, can you think about any common precipitating factor? That means something in particular that caused these attacks of giddiness to happen, or something that was there when the attack started, like say some chest pain, after that you started getting the attacks of giddiness, or some buzzing sound in the ear and then you started getting the giddiness, or any headache, then you started getting the attacks of giddiness, anything like that, any common thing which was there in each of these attacks.
You are absolutely correct. There is no trigger that precipitate or provoke that giddiness.
What is the actual feeling like? Do you feel that the surroundings are moving? Or is it something like a sinking sensation where you are thinking that I will slowly pass out? Is it something like that, that I will slowly pass out and then fall to the ground? That is a completely different feeling. It is usually accompanied by blackouts, a blurring of vision. Is it something like that? Or is it just phases of destabilization? That means there is no spinning or there is no sinking, but you feel that you have suddenly become very unstable and something is pushing you from behind, something like that. So you have to differentiate between whether it's a spinning attack, whether it's a sinking attack, or whether it is something like a destabilization for a few minutes. That means a phase of unsteadiness only, without any spinning attack.
No sir, in a typical head spinning attacks, I feel that surrounding is moving, and I feel unstable when surrounding is moving very fast, but there is no blurring of vision and all.
During the attacks of giddiness, what other accompanying features are there? Do you feel any deafness or blockage in the ears, any buzzing sound in the ears, any headache with it, or any weakness of the limbs? Anything that you can say that accompanies the attacks of giddiness consistently. Once or twice something may be there, but then you have had so many attacks. If there is any consistent accompanying feature which is there in most of the times, then tell me.
No sir, nothing of a sort. Actually I have the block feeling in right ears that 10 to 12 years before starting of my giddiness. And if you are telling, then now I can correlate that in some episode of Vertigo, I feel that there is a blocking episode of right ear in some instances.
Do you or did you ever have any throbbing headaches during the attacks of giddiness?
No sir, just occasional headache I have that anybody has, but there is not. This is not associated with nausea and vomiting.
Anybody in the family has headaches? Did you ever have motion sickness? That means a feeling of nausea and vomiting, or head spinning also during travel. That means when you are traveling in a car or in a train, you get attacks of nausea, vomiting, head spinning, etc.?
No, sir, nothing I remember of.
Did you ever have any tests or any investigations related to the balance system? That means any vertigo specific tests being done?
So a lot of investigation I did, and everything is normal except mild high frequency deafness at right ear, and all the normal reports that I got from MRI, DVA, EMG, etc. And in my place nothing is done more than this, so that's why I am here.